Hey, this is Dr. Amanda with StraightSmile Solutions, and today we're going to be talking about a really common question I get. And hey, make sure you visit my website, it's straightsmilesolutions.com. We also have a patient-facing Facebook support group. Ping me if you'd like to learn where it is. We'd love for you to subscribe to our Facebook group. A lot of great information is going on from patients. They want to know a little bit more about orthodontics, about their treatment. So one question I got today was a patient of a doctor was recommended have 4 buys out for an extraction plan. So let's talk about that. What are 4 bicuspids? So bicuspids are the teeth here, 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 and here. And there's 2 sets. Theoretically, you do fine with just 1 set. It won't really change the aesthetics or anything like that. And traditionally, when someone was very crowded, that was done. You would take out a couple teeth, right? Well, things have changed. And really in the last 10 years, I would say, most orthodontists are gravitating towards non-extraction methods. And there's all sorts of different methods as to how. I got a really good question. They said, well, how do you make the space and if you're not pulling out teeth? Well, lots of ways to make the space. And of course, I'm going to say the younger the child is, the better. You bring this child in age 5 and it's saying, I want to have more space. I know she's going to be crowded. What can we do to even prevent the need to take teeth out? We can totally do that. But 15, 16-year-old patient like this comes in, let's say this is really crowded, which is not right now. We're thinking, oh, easy, let's pull out 4 teeth. Yeah, that might be easy, but what else could go wrong if you do that? Not to mention the discomfort, but also the arch size is different. The arch size might be more narrow. The lips on the patient will sit further back because the teeth are retracting a little bit in many cases. And it also may decrease the actual volume size as the whole arch is more narrow for the tongue to sit in, and that's not so great. That's the one I'm most worried about. And then cosmetics, of course, right? So what's our alternatives? Well, we can expand. So expand means just 1 or 2 millimeters expanding the arches out, right? Top and bottom, as needed. We can distalize, which is where we might use some additional adjunct, different appliances, extra bonus items to help slide the teeth back. You might have to have your wisdom teeth out first if we're going to do that. Or we can push the teeth forward. Okay, so lots of different options. Last option, if you really, really do need a little more space, is to do something called interproximal reduction, or IPR. And I think most of you have heard about it. And there's all sorts of different materials a dentist can use to do IPR. So I'm just going to throw out one here. But some of them involve drills and files. The ones I like are, and this is actually really, really fine gauge, but it's almost like this, okay? It's a strip, and you go in between the teeth, and then you file. This really doesn't do that much because it's so light. It's more for polishing. But you can kind of see how it works, okay? You do each side. So the most I think you should have off between 2 teeth is 0.5 millimeters. That means 0.5 millimeters, which means 2.5 millimeters. 0.25 millimeters to each side of the tooth, the right and the left, okay? And the interproximal space would be 0.5 millimeters. That's the most. So make sure if you're getting IPR to document where you're getting it, just in case later you get another ortho case and they don't know. Because if we take off all your enamel, you're not going to have any protection for that tooth, and that tooth's going to need a root canal and a crown. So really, really important that you communicate that with your doctor if you have a history of IPR. So IPR is great. You can get a ton of IPR. Theoretically, if you do the math, if you do up to 0.5 millimeters on every single tooth, let's count how much we can get. So 5, 10, 15, 20, 25, 30, 35, 40, 45, 50, 55, 60, 65. All right, so that would make 6.5 millimeters total. Well, holy cow, 6.5 millimeters total is the size of 1 tooth, right? 1 premolar. Well, they may be like more like 7, 8. But there you go. You just got half the space you need just through IPR. Now you don't have to take out a tooth. Of course, we need other space, either through pushing things back, pushing things forward, or when bending things out. So anyways, and then another good gauge, another tip if you're going to do interproximal reduction is to make sure your doctor is using this called an IPR gauge. So what you can do is a doctor will go in between the tooth that he just did, and there's little numbers on here, like this one is 0.25 millimeters, that kind of stuff. So you go ahead, you put it in and see if it, see that one clearly doesn't fit, so that's not the right size. Do this one, does not fit, not the right size. Nope. Try again. Haha! That's the size. Okay, so we actually did, yeah, it was 0.25 millimeters. Very, very good. So that tooth has 0.25 millimeters in between the teeth, which means you could do a little bit more IPR on that tooth. So hopefully that was very informational for you about IPR and non-extraction cases.